Hello and welcome to this week's CEO blog. We've been covering some of the major parts of our efforts around Community Health 2020 and the activities of our foundation in moving us toward a self-sustaining, self-determining healthcare system for our community. Last week I talked about the Endowment for Quality and Access, and this week I want to give you a little bit of a capsule around the Center for Learning and Innovation. Center for Learning and Innovation was actually established about a year ago. Even though we don't have a physical space, we don't have a dedicated director who's heading up the work of the Center for Learning and Innovation, we do have a business plan. And we have a set of areas of focus and attention that we're going through as we continue to develop the Center for Learning and Innovation. The staff for the center right now is me and Jeannie Eiler and Megan Guido and Ruben Mays and Katie Everman-Druffel and Steve Dunning and several other people who are exploring ways of changing how we provide care in our community and reaching out beyond the walls of the hospital to meet patients' needs. The Center for Learning and Innovation becomes that incubator, it's that idea generator, it's how we can explore possibilities. We've been fortunate enough through the efforts of the foundation to acquire some grant funding to help us expand that reach. We're working with a technology company out of Spokane called Gemini Systems, who's developed some pretty amazing software that is aimed at helping people with speech development activities. We're working with them through a grant from the USDA to see how we can take that technology and make it more available through the public schools in Whitman County to address the speech therapy needs that are present there and provide a much more meaningful experience that is showing evidence of making improvements in those activities. We've recently received a grant from the Hersha Group out of the federal government for organizing a group of regional providers. The Palouse Area Health Network is the group we've organized to help us understand where we might have gaps in care for women and or children in our region, and develop a strategic plan of how we might best meet those needs going forward. So the Center for Learning and Innovation has a lot of different things that we're experimenting with, whether it be social services or health psychologists, having a more interactive role with primary care physicians in providing a team approach to care, whether it's telemedicine services like telestroke or telepsychiatry, using technology to reach out, or even another grant opportunity we're pursuing that will make health coaching more prevalent in our community for designated populations, and how that health coaching care navigation process can really strengthen individuals' ability to effectively manage their health, especially if they have a chronic illness that they're trying to manage effectively. So the Center for Learning and Innovation becomes an integral part of Community Health 2020 as we identify how to organize the care in our community more effectively, to improve quality, to lower cost, and really make a difference in the patient experience. So continue to look for announcements from the Center for Learning and Innovation around new projects and opportunities that we're pursuing. And I hope you stay tuned to these blogs and stay up to date with the things that we're talking about, and I hope you choose to have a great day.